Heart disease is the #1 killer of both men and women in the U.S. But did you know there is a test that can determine your risk of a heart attack in the next 10 years?
Wow. Well, when it comes to healthcare, we know that rarely do we get anything for free until now. It's according to senior health correspondent Monica Robbins, who joins us live from University Hospital's Harrington Heart and Vascular Institute. Monica, you got to explain this.
Yeah, I do have to explain this. And ironically, this has been going on since 2017. So joining me now is Dr. Sanjay Rajagopalan, and he is the chief of cardiovascular medicine here at UH's Harrington Heart Vascular Institute. So where are we right now?
Well, you're sitting right in front and side of the Advanced Cardiovascular Imaging Center. And this is a construct that we put together many years ago that brings together the latest technological innovation in imaging, cardiac imaging, together with interventional approaches. And right next door, my colleague and the director of the Harrington Heart and Vascular Institute, Dr. Mehdi Shishibo, is doing an advanced peripheral intervention. So this is what we do every day, and using imaging to guide interventions, particularly advanced interventions, is sort of the specialty.
But let's talk about calcium score, because that's what we're here for. That's what we're going to do. What is a calcium score?
So a calcium score is a CT scan, which is a sophisticated X-ray that detects calcium deposition in the arteries in your heart. And it turns out it is the best predictor of future cardiovascular risk.
But why doesn't insurance cover this?
Well, it's one of those mysteries in American medicine, right? Some of the most important things that can really save lives, and are also preventive therapies are not reimbursed for, but that's hopefully changing.
That's changing, but since 2017, University Hospitals has done 125,000 of these for free. Are they still doing them?
Absolutely. I think this is a commitment that University Hospitals, the Harrington Heart and Vascular Institute, working together with the Department of Radiology, has made to the community that we serve, because we really think this is important. This is important for prevention and identification of risk so that patients can be empowered with information that they need to modify their behaviors and take the appropriate medications.
So who needs one? So if you're 45 years or older, if you have high blood pressure, if you have high blood cholesterol or low HDL, if you're a smoker, type 2 diabetes, family history of heart disease or chronic inflammatory conditions, all you need, you can be a patient at any other hospital, but you need a referral from your doctor, right?
That's right. You need a requisition, and that's it. If you meet the criteria, if you happen to have risk factors and you belong to intermediate risk category, as defined by the American Heart Association, American College of Cardiology, you can get scanned for free.
All right. So coming up at 5, I'm getting in this machine. I'm going to get a scan and show you exactly how easy it is. And then coming up at 6, we're all going to go over my results together, guys.
Wow. Monica, okay, this is big.
Yeah.
And honestly, this is big for you, but this is big for so many people watching who are at that point where they're saying, you know what? I need to get my health checked. The heart's is so important as we talk about the death toll when it comes to their deaths when it comes to hearts. So we'll see you then. We're looking forward to it.
You got it.
Okay, thanks so much.
All right.